Dan, what applications of GenAI in healthcare are you most excited about at the moment?
When I think about a tool or a set of tools as promising as GenAI, I set my sights on the biggest overall problems of healthcare, and those emerge from taking a system perspective. The problems of healthcare are systems problems. We're trying to get alignment between the interests and capabilities of life science innovators, of patients, of healthcare providers, of payers, and of regulators to all line up. It's an incredibly difficult problem, so much so that it's a wonder that things work as well as they do. But they don't work perfectly, and there's still enormous unmet need out there. In particular, there's the problem of getting life science innovation done at a sufficiently low cost that an appropriate risk-adjusted return can be generated in a market where the right patient is getting the right treatment at the right time. Now, if you look at that problem, that economic problem, the opportunities for GenAI jump right out. There are two big ones that stand out for me. One is getting the cost of life science innovation down, and across the entire R&D value chain for pharmaceuticals and for medical devices, you see one opportunity after another for GenAI to help identify new targets, identify new technologies, and get through the clinical trial and the development process to go faster and cheaper. On the other end, in the market, the use of GenAI to align the needs of patients, providers, and payers are very strong. All want to see the right patient getting the right treatment at the right time. The current healthcare system we have is not able to do that, but GenAI tools can help to identify those pockets where every provider and every payer can every day be creating value for patients.
Is mental health going to be a huge priority, do you think, going forward?
It's going to be enormous in the US, in developed markets, and in developing markets. I mean, we all read at some level about in some abstract way about a mental health crisis, but the rising prevalence of depression and anxiety, the spread of eating disorders, addiction disorders are coming into huge focus. Neurodegenerative disease that is in some cases connected to that are becoming more and more prevalent, and we're far behind on having the tools to address those, not just scientifically, but also in our health system. Reimbursement and access to providers for mental and behavioral health is extremely poor compared to other areas of medicine. And I would not say there's not technical unmet need there, but we have a great health system for delivering the latest breakthroughs in oncology and in immunology. We do not have a health system that's equipped to deliver the latest breakthroughs in mental and behavioral health, and we need to change that.
How do you think that change will come about?
I think it will come with increasing awareness of the problem. I think it will come with systems innovation. I think there will be innovators on the care delivery business model who will help to integrate more effectively the patient identification, the right tool for the right patient at the right time, and the right level of reimbursement in proportion to the value of that intervention.
Can I ask what you do at your organization to foster a culture of innovation?
So for us, being able to spot and nurture innovation is the absolute essence of what we do. And the first principle for doing that effectively is really being tuned into what is happening out in the world. Not to the point where you're overreactive and every single thing you see causes you to pivot, but to really know where is the most good to be done that will not otherwise be done. For philanthropists in healthcare itself, it's particularly important to say, what will the market eventually do? What will government eventually do? And what's the gap that's left for philanthropy? So understanding what ideas are out there and having a really good listening, a really good sensing system, and then being able to identify where is the intervention that we can do that no one else can do helps our organization to drive innovation most effectively.
Thank you so much for your time.
All right, my pleasure. Thank you.